Well, COVID-19 vaccines have helped prevent thousands of deaths and infections, but there are still so many patients who refuse to get this life-saving shot. One traveling ER doctor is working to explain to his patients that rolling up their sleeves for a vaccine and wearing a mask are the most patriotic things they can do. Dr. Marc Rosenthal has been on the front lines of COVID-19 surges around the country, and he is here to tell us about his experiences. Doctor, thanks for joining us. As part of your work with the National Disaster Medical System for the past 20 years, you have been sent to struggling communities across the United States. And this summer, you were in Louisiana as the Delta variant was surging in that state. And before that, you went to Wisconsin. Describe what you saw in those emergency rooms.
Thank you very much for having me. In Wisconsin, I actually was a floor and ICU physician. In Alexandria, Louisiana, I was in the emergency department. What we saw is a large number of COVID patients, mostly unvaccinated, unfortunately, many relatively sick. We did, and they do admit a fair number of their patients with COVID that required high amount of oxygen needs and the like. And it's just something that it's sort of heartbreaking. Because at this point, the virus is preventable to a certain extent.
You tell people that getting the shot is patriotic. And I think that's a really sort of interesting way of approaching it. The messaging was initially, wear your mask to protect other people. That didn't seem to work. Protecting other people didn't seem to be a motivation for at least some segments of the population. Why do you tell people that it's patriotic to get the vaccine?
The reason I think back to when I was a kid. I mean, unfortunately, I'm retirement age, so when I was growing up in the late 50s and the 60s, when vaccines came out, like the polio vaccine, people lined up to get it. And it wasn't not a communicable disease, but you're protecting yourself, protecting the risks of being being in an iron lung. And it seemed like Americans back then were definitely more supportive of their neighbor. If there was a risk, people would help, even risk themselves. I don't see that as much now, but to me, getting the vaccine is not just protecting yourself, which is important without question. It's also protecting your family, protecting your neighbor, protecting your coworkers. The fact that one can get COVID and transmit for 2 to 3 days before you're symptomatic makes it high risk in an unprotected environment to pass it on to someone else. And down the line, it's going to get to someone who will end up dying of the disease. And that's why, to me, if we as Americans want to help each other, and that's part of patriotism, at least is how I look at it, it's important to get the vaccine. It's a very safe vaccine. It's not a vaccine that has a high risk of severe complications or death compared to some of the others that have been available in the past, like smallpox vaccine, but it works. It's safe. And it's just, to me, better for people to get it and prevent this disease.
Has that worked, Doctor? Because I'm curious. One of the things, and we've talked about this on this broadcast, is that we know that trying to shame somebody, trying to scold somebody, trying to make someone seem as if they are not smart because they choose not to receive the vaccine doesn't work. If anything, human nature suggests that people dig in when they feel that they're being attacked for something that they believe in. So when you try to turn the conversation around to make it less about somebody pointing fingers at somebody who's anti-vax, who doesn't want to receive the vaccine, and you try to appeal to their better angels, have you had some success with that?
I mean, I've not used the term patriotism with my patients I've seen locally. I do, and I think most of emergency physicians in the country will explain to the patient the risks and benefits of the vaccine, and especially as relate to what COVID does, the risk of deaths from COVID. And sometimes it works, sometimes it doesn't work. It's one of those things that it's very, very difficult to change a person's mind who has formed an opinion from other sources of information. I mean, I realized that initially back in the spring, there were people who wanted to wait to find out whether the vaccine was truly safe or not. Obviously, the phase 3 trials that Pfizer, Moderna, AstraZeneca and Johnson & Johnson have done was limited number of people, 30,000 people and the like. But now that we've had billions of people receive the vaccine and do very well with the vaccine, that type of hesitancy should hopefully go away. But there's, people who still don't believe in vaccines, and you try to convince it's not just for them, but again, it's for protecting your family, your neighbors, friends, and the like. And that sometimes doesn't work that well.
Mm-hmm. Yeah, because if you don't believe in the vaccine, if you've been reading some of this misinformation out there about the vaccine, then, there are people who honestly feel like taking the vaccine would be damaging to their health, would be putting their children at risk. They actually, they believe that they're doing the right thing by not taking the vaccine. And you've talked about the mistrust of science and the disinformation, misinformation, I should say disinformation, because some of it is deliberate on social media. I'm curious about some of the things that you've been hearing as you travel across the country from patients.
I've heard, and even from a family member that don't believe that COVID is real. I've heard that the vaccine is too dangerous. They take data from the CDC vaccine reporting database and say, well, it's been 5,000 people have died or whatever number, without understanding just because the reports doesn't mean people actually have died of the vaccine. And a lot of them just don't trust the government, unfortunately. And it's when don't trust the valid source of information and don't understand science, it's very difficult to convince people. And you try your best to show why the vaccine is useful, how it prevents death, and basically ending up in the hospital. The vaccines are extremely effective and have saved countless lives. I mean, I've read one report thinking about 40,000 lives might have been saved with the vaccine in the elderly population. It might even be higher than that, but it's one of those things that the vaccine works along with social distancing and mask use. And the literature is very strong about the support, how it works. There's been good, randomized studies looking at mask use. It saves lives. It decreases the risk of transmission. And for every 100 people potentially who get COVID, one might die. It's a deadly disease. And albeit a lot of people also look at the fact, well, the chance of me dying is only 1%. Therefore, I'd rather not have the vaccine because I'm worried about the side effects and the long-term effects of the vaccine, whether it be the mRNA vaccines, which are a little bit newer, but are really extremely elegant technology versus the standard vaccine.
Dr. Marc Rosenthal, thank you very much for coming on. Thank you for what you do. We appreciate it.
Well, thank you very much for the interview.